2020 has been all about the coronavirus, but there is a deeper long-term issue going on, the health impacts of climate change. A new report in the Lancet says healthcare systems are not prepared for the increasing threats posed by a warming planet, a reality researchers call the most worrying outlook to date. As Eric Sorensen reports, they say the two global crises pose similar dangers that should be addressed in tandem.
In 2020, climate change was overshadowed by COVID-19, but that has not slowed the relentless rise in global temperatures. A new Lancet study says health systems are not prepared for the impact a changing climate will have on both lives and livelihoods. Rising sea levels will displace millions, big cities will bake, wildfires and smoke will damage lungs, drought will destroy agriculture, and excessive heat will take more lives.
We know that when it is extremely hot, people tend to die more, so there's an increase in mortality.
The Lancet study sees parallel threats from climate change and COVID-19, especially for the elderly. In Canada, people over 65 account for more than 90% of all the COVID-19 deaths since March. At the same time, people over 65 have seen a 58% increase in heat-related deaths in the last 20 years. Climate mortality statistics are more gradual, but just as real. Overall, more than 12,000 Canadians have died from COVID-19 this year. From climate change in 2018, mortality from heat coupled with air pollution, deaths exceeded 11,000. For COVID and climate, the consequences are serious. On the economy, the pandemic has cost more than 500,000 Canadian jobs this year. Less visible, extreme heat has seen 7 million more lost hours of work each year compared with 30 years ago.
These health impacts are so significant that it's going to cost more to our economy not to address them than if we take the initiative to address them in a timely manner now.
The pandemic exposed the stress on our healthcare systems, but provides an opportunity to get it right for the growing climate crisis.
We can't just tackle one crisis at a time. We need to come together and address the climate and health crisis as well.
The aim, say researchers, should be to align a COVID recovery with a green recovery.
It's kind of a triple win situation here. We have the potential to create better public health, protect the environment, and have a sustainable economy.
One more health warning: if we don't address climate change, a warmer planet will increase the risk of animal to human disease transmission. In other words, pandemics could be more likely in the future. Eric Sorensen, Global News, Toronto.